Hello, Mrs. Jones. My name is Esther. I'm going to be your CNA for today. How are you? Okay, I'm here to help with an oral care. Is that okay? Okay, then I'm going to provide privacy, curtain, go wash my hands, gather my supplies, and I'll be right back, okay? Okay, I am back, and since my hands are actually clean, I'm going to assist you in a sitting position by using my paper towel to touch your bed remote, okay? So here we go. Since it's an oral care, the patient must be sitting all the way up in a sitting position because we don't want her or him be choking. I think this is comfortable enough. I will discard my paper towel and gather my supplies. First, let us create a barrier for our clean supplies. We have this, and I'm going to bring it to the side. Next, I will need a cap for water. I'm going to need my emesis basin, toothpaste, and a toothbrush. We are going to need a clean towel, our emesis basin, toothpaste, and toothbrush. We should also need a cup. So Mrs. Jones, I'm going to get water and I'll be right back, okay? All right, let us make sure you are comfortable. Can you sit up for me? We push the pillow in there. And we need a set of gloves. We're going to need a set of gloves for this care because we are going to be touching the patient's wet area, which is the mouth. We don't want to be putting in any germs or bacteria. Now we have to protect Mrs. Jones' clothing by not shaking the towel. So since this is an oral care, I'm going to help brush your teeth, the upper teeth, the lower, your tongue, and then you rinse your mouth out, okay? Let's prep our brush. We're going to soak our brush in the water to moisten it. Put a little bit of paste on there. Keep it in our emesis basin until we are done. Let me put my gloves on. we are going to moisten Mrs. Jones' mouth a little bit. You can also skip that part because we moisten the brush. So Mrs. Jones, can you open your mouth for me? We're going into the mouth. Go to the back and clean the upper teeth, to the front, to this other side, the back and the front. We can be rinsing Mrs. Jones' mouth. Can you spit it out for me? Thank you. And then we come to the bottom, the front, and the other side. Mrs. Jones, can you clean your teeth together? We clean the front of the teeth, up and bottom. Mrs. Jones can be rinsing in between. Thank you, ma'am. Can you stick your tongue out and clean the tongue really well? Rinse, rinse, rinse. Spit it out. Do you want another water? Rinse. And you spit it out. And then we can rinse. Put the brush back, pour the water in, and always make sure you wipe Mrs. Jones' lips nice and clean. If she prefers a moisturizer, you put some on the lid, and that will be the end of the oral care. So now we're going to take our linen off Mrs. Jones and discard in the hamper for it to be washed later. I'm going to get rid of whatever we have here. Go pour out my fluid and I'll be right back. This is fluid in a basin, and we discard the fluid the same way you discard any other fluid in a basin. You pour out the fluid, you rinse it out, you get a paper towel, hold the basin, wipe it off, go into the room with a clean paper towel so you can open jars and then store your basin.